Hello, it's a health news that delivers health information through text and sound. I'll give you useful information today as well-being. I'd appreciate it if you could press the subscribe button before we start. This time, we'll learn how to prevent itching. What are some ways to prevent itching? Itchiness is an unpleasant feeling that causes the desire to scratch or rub the skin. Itching can occur in a variety of stimuli, including physical and chemical contact, temperature, and humidity changes. It can worsen in a warm environment, and is also affected by psychological conditions such as severe stress and anxiety. And it gets worse at night. Most itching is accompanied by a disease of the skin itself. But it is important to find the exact cause and treat it because it is sometimes associated with systemic and mental diseases. What's the cause of itching? 1. Itchy accompanied by skin disease. Skin disease is the most common cause of itching. Shep dermatitis, osmosis, insect bites, hives, atopic dermatitis, contact dermatitis. Psoriasis, monetary eczema, a disease in which eczema appears in a coin shape. Psoriasis, a symptom of thickening and severe wrinkles. And neurodermatitis cause itching. Winter itching occurs in more than 50% of the elderly over the age of 70. The main reason is that moisture decreases due to aging of the skin, sebum secretion decreases, and the skin becomes dry, and itching occurs easily in the arms and shins. Symptoms worsen in wintertime with frequent baths, excessive use of soap, and dry and high indoor temperatures. Anus itching is common when you have rectal anterior disease or infection. When the anus is contaminated or stimulated by feces. It is common in colorectal antimicrobial diseases such as dentures tornis tear. Hemorrhoids, gastric hemorrhoids, secreting from inflammation around the anus, and chronic diarrhea. Infections such as bacterial infection, candida infection, and simple shingles virus can also cause anal itching. Also, when you eat spicy food, anal itching can get worse. The itching of the vulva can be caused by friction, sweat, pregnancy, pads, contraceptives, vaginal cleaning fluids, and condoms. Infections such as candidiasis and trichomonas vaginitis are also the cause. Men's scrotum is a site where chronic simple placenta, which thickens the skin, occurs well, and in severe cases. It lasts for years even if intensively treated. Waterborne itching lasts for about an hour with a needle within minutes of exposure to water. Scalp itching is a symptom that can occur without a clear lesion of the scalp. And it is common in middle-aged and older and becomes severe when tired or stressed. 2. Itchy accompanied by systemic disease. Itchiness is also accompanied by systemic diseases such as jaundice, chronic kidney failure, malignant blood tumors, genuine red blood cell increase, parasitism, hyperthyroidism and dysfunction, and acquired immune deficiency. In 20 to 25% of jaundice patients, there is itching, and in patients with obstructive biliary disease, chronic liver disease, and cirrhosis, the entire body is accompanied by severe itching along with jaundice. About 20 to 50% of chronic renal failure patients on hemodialysis have itching. Malignant tumors and iron deficiency anemia also cause itching. About 50% of patients with true red blood cell syndrome experience severe itching within minutes of contact with water. This is because increased skin blood flow increases skin surface temperature and lowers the threshold for itching, the minimum intensity of irritation that can cause symptoms. In hypothyroidism, mucus tree species can cause severe dry skin, resulting in systemic itching. Itchiness is common in diabetics. Diabetes makes you sensitive to itching. And diabetic renal failure makes you itchy all over the body. Acquired immunodeficiency disease is often accompanied by systemic diseases such as osmosis, lice, candidosis, seborrheic dermatitis, kidney failure, and bile accumulation. In liver tissue and blood, abnormal liver bile secretion function, which causes itching. 3. Itchy accompanied by psychiatric disorders. There are lesions on the skin, but there are diseases that do not have dermatological or other organic causes. Neurotic excoriation is a dermatitis caused by patients repeatedly and obsessively tearing, digging, and scratching their skin. Artificial dermatitis is a dermatitis caused by intentionally wounding one's skin with chemicals, corrosives, nails, sharp tools, and hot metals to cause compassion or avoid responsibility. Patients often get hurt in order to satisfy their psychological needs, denying or indifferent that they did. Diagnosis and examination. Check the location and persistence of itching. And check the history of taking the drug that causes itching. It is most important to find and treat the cause of both itching caused by skin disease and itching accompanied by systemic disease. The cause disease is examined and treated by performing rectal anastomosis, pelvic examination, general blood test, chest radiation test, stool test, thyroid gland, liver and kidney function test, and blood sugar test. Therapy. It is most important to find and treat the cause of both itching caused by skin disease and itching accompanied by systemic disease. However, along with the cause treatment to calm symptoms is also needed. Itchiness is greatly affected by temperature changes around the body, so it is helpful to wear thin and light clothes and cool your skin. It is advisable to avoid exposure to irritating fabrics such as wool and to break the habit of scratching, tension, anxiety, etc. Worsen itching, so avoid mental stress. For itching caused by inflammation or parasitization, it is effective to administer steroids throughout the body or apply them to some parts. Local application. It is also helpful to cool your skin with calamine lotion or menthol lotion. Various first or second generation antihistamines are commonly used as internal medicine. Antidepressants or anti-anxiety drugs are helpful for itching that does not respond well to treatment. 1. Itchy accompanied by skin disease. It is effective to apply moisturizer to dry skin several times a day for winter itching. Do not scrub the dirt or use excessive soap. And apply moisturizer immediately after bathing to prevent dry skin. Local steroids are helpful, and ambient temperature and humidity should be controlled. Anus itching should be checked for rectal anal disease or infection and avoid stimulating food and drugs. It is essential to keep clean without scratching around the anus. Antihistamines and topical steroid ointment are effective for dermatitis accompanied by itching in the absence of fungal infection. After defecation, wipe with a soft tissue and wash with water using non-irritating soap if possible. Candida vaginitis is well treated with antifungal suppository, and trichomonas infection can be treated by taking antibiotics or inserting them into the vagina. Light therapy can also help. 2. Itchy accompanied by systemic disease. It is a principle to treat the systemic disease that causes it. For example, obstructive jaundice patients with jaundice need antihistamines, cholesterol, light therapy, plasma blood transfusion therapy, or surgical treatment to break through blockages of bile. 3. Itchy accompanied by psychiatric disorders. Itchy accompanied by psychiatric disorders requires treatment by a psychiatrist, because common dermatological treatments are not effective. However, it is important to administer antihistamines that reduce itching, and combine psychological support therapy while maintaining a close relationship with the patient, as the patient tends to seek another doctor instead of going to the psychiatry department of psychiatry. Frequently asked questions. Q. What are some ways to prevent itching? A. I use thin and light clothes and bedding. Because itching is greatly affected by temperature changes around the body, it is advisable to avoid the use of irritating fabrics such as chemical fiber or wool and to break the habit of scratching. It is also good to avoid mental tension such as stress. Caffeine, alcohol, and coke in coffee, tea, and chocolate can worsen itching. It is recommended to avoid frequent baths and apply moisturizer to the whole body after taking a bath for itching caused by dry skin, which is common in the elderly. Q. My skin often itches. Don't you have an OM? A. OMG is an itchy skin disease caused by small ticks that live on the surface of the skin. When you get a lump, very itchy red spots occur in many places. It's more itchy at night. It's especially common on the groin and fingers. OMG ticks make tunnel-like OMG tick oysters in the outermost stratum of the skin. It is often transmitted through physical contact, so all families should be treated at the same time. Diagnosis can be diagnosed by characteristic itching, discovery of osmite oysters, family history, etc., and can be confirmed by checking osmite under a microscope. Q. Is it a good idea to take a sauna when your skin is dry and itchy? A. The basis of treatment for dry skin is to hydrate and maintain the skin surface and to protect the skin from external hazards. To do so, you should shave off the dirt, use excessive soap, and avoid sauna. If itching is severe, be careful not to cause wounds or secondary inflammation caused by continuous rubbing or scratching the skin. Q. If my skin is dry, how do I take care of my skin? A. Use mild cleaning products because your skin is very sensitive. When wiping the water with a towel, do not rub it, but wipe it lightly. And it is recommended to apply moisturizer immediately and regularly. Use moisturizer at ordinary times because the skin starts to dry 3 minutes after bathing. It is recommended to use a humidifier while keeping the indoor temperature at 20 C so that it is not too hot, and to hang wet laundry or leave a wet towel indoors when there is no humidifier. This time, we learned how to prevent itching. Thank you for watching until now. Subscribe and like are a great help to video production. Thank you.